Hi there, good morning. My name is Gerard Green. I'm a male pelvic health physiotherapist from Birmingham, and it is Monday, the 26th of April. And the summer looks like it has arrived in the UK because it's really warm out there. Doing well in vaccinations. Fingers crossed things are improving. And it gives me really great pleasure to speak with my good friend and colleague, Mr. Karl Monahan. And Karl is from London. And Karl is really well known in the world of male pelvic pain and everything kind of male pelvic floor dysfunction wise. And in addition to seeing and helping lots and lots of men with pelvic pain and pelvic floor dysfunction, he is a really big advocate for men patients to get more help and to get more information about what's going on. And he also set up the Pelvic Pain Matters kind of self-help group, and also he brings lots of experts in to talk and just really, I suppose, creating a community, a supportive community. So Karl, I have to say this, I've said it to you before, I've got background envy. Karl has some really cool background stuff going on there, whereas I've got bee cushions.
They're very nice though, Gerard. I'm very jealous of your bee cushions as well.
So Karl, just maybe give us a summary of what you do in terms of male pelvic pain.
Yeah, thank you, Gerard, and thank you for having me on here. It's a pleasure to speak with you again. Yeah, so having had pelvic pain in my mid-20s, I'm well aware firsthand of what it feels like to go through pain, and often the journeys that these patients are taken on as well. So being fobbed off from urologists, not getting the right care, generally speaking, this is, and then kind of struggling around to really find the right solutions for their care. So I only treat male pelvic pain. That's all I do. It's a very integrated approach, looking at multiple facets of the individual, really trying to understand them not only as a pain patient, but as an individual. What is it that's been taken away from them in their life? What are they not able to do anymore? Is it relationships, personal, professional, social relationships? Is it sporting activities? Because there's more than just the pain in a patient. The pain is one thing, but the suffering that comes along with that can often exacerbate it and leave a patient in a real spin. So yeah, really integrative. I spend a lot of time getting to know my patients as best as I possibly can. I'm a teacher by trade as well, so a lot of my approach is around education, and I find if a patient understands some of the driving mechanisms behind the reasons they are in pain, then they're generally better versed moving out of pain as well.
Brilliant. And what for those who maybe don't know in detail, what is the Pelvic Pain Matters project?
So as it stands at the moment, and what people are seeing online, Pelvic Pain Matters are educational webinars for both patients and clinicians with an interest in pelvic pain. We also encourage family members and friends, etc., to join the webinars. But the idea is bringing patients and clinicians together so that we can create a brighter future. And what do I mean by this is that it's very rare that in a non-clinical environment that patients and clinicians get together. You'll often see a patient and clinician in a clinical setting, and it's very focused on that individual, but they're not necessarily getting together to get the future for pelvic pain more open, more talked about, more understood. So we have a guest speaker, and the guest speaker has a very particular interest in pelvic pain. We then have a panel of typically a patient and a clinician, and then we have the audience, which are also patients and clinicians. They're very interactive. Some of them are incredibly practical as well. We just did one on mindfulness. Our next one is on CBT and clinical hypnotherapy. So yeah, it's trying to educate people again, both clinicians and patients, and really to try and drive treatment further forward so that everyone's getting the right results, both again the clinicians and the patients also.
And what's the general response been to that, Karl, from the people who've attended, both clinicians, patients, partners?
Mm. So people are saying it's a really supportive, encouraging, and nurturing environment. Um, that, from a clinician's point of view, they can ask a question that's relevant to their practice with the particular techniques that we're using. So it means they then get to go and put them into practice straight away. We give a goodie bag after the event as well. So whatever science, whatever research it's being backed up by, whatever methodologies or approaches, the clinician has those straight at the end of the session. And from the patients, they're finding it's really supplementary to their recovery as well. So again, because of the practical elements, because of the goodie bags, not only are they being directed in the webinar itself, but they're being given lots and lots of resources afterwards that can help guide and steer their recovery as well. So we've been going now for 6 months as it stands with the webinars. There's lots of future projects that are coming up. We just had a meeting this morning around what else to expect. But at the moment, yeah, webinars for patients and clinicians.
And in a strange way, Karl, has COVID almost helped that process, that people are much happier doing this on Zoom, attending webinars, engaging, being at home, feeling so? In a way, has COVID really helped that grow?
It's a great question. I think, we were talking about the webinars for a while, and we started to develop them last year. And then last summertime, we put it into practice, and it's allowed us to reach a wider audience in a different way. Beforehand, we may have been doing them or considered doing them face to face, which means people coming to London, and the audience may have been very localized to London or the home counties, etc. Whereas now, on our webinars, we're getting people in all time zones. We will get people in the west coast of America all the way through to New Zealand and Australia, all joining together. So that collective element of those attendees is really, really helpful as well, because different cultural associations or different cultural influences over pain, maybe different methodologies or approaches that might be used in different countries, etc. as well. It's been really, really, I'm going to say great. I don't mean COVID was great. I mean the opportunity that's arisen from it and what it's allowed us to do.
Yeah, but I know what you mean. I know what you mean. And I suppose, it seems like the Pelvic Pain Matters project is just growing and growing, which is great to see.
Absolutely, yeah. I think because there are lots of great opportunities out there for patients and clinicians. There are more and more opportunities for patients and clinicians to hear from guest speakers, to get really direct and specific information. And I guess maybe it's a sign of the times that perhaps if we'd have done this, 2 or 3 years ago, maybe there wouldn't have been as much of an interest. But now, because most of us tend to live in these little boxes on our TV screen or computer screens, then it's just given us a real kind of springboard, I suppose, to take this further forward. And then off the back of this, we're going to introduce more series of with specialist guest speakers about how to go down a particular pathway of care, whether that might be movement based, might be stretch based, it might be CBT, it might be nutritional based. We're looking at very specific techniques and pathways of care, recovery strategies, recovery workshops for patients as well, and then how that may feed back into clinicians. And we're setting up mentor groups. There's lots and lots of things to come at the end of this year and then the start of 2022 as well.
And I suppose it's good to have all of that community and support and mentorship and expertise centralized somewhere, because men and their partners, to find out information on pelvic pain, they've got to go through Reddit, Facebook, Twitter, Google. So it's a really admirable project. It's a really admirable project. And so COVID's probably helped that project grow, because we're all happier being on Zoom or online. So what impact has COVID had on say your work with patients?
Yeah, so I've done telehealth with patients for a while now. Even before this, when I set up Pelvic Pain Matters, I used to do initial consultations online, so via Zoom or Skype, or WhatsApp calls. So that was always a part of my approach and my methodology with patients. Because we haven't for the whole been able to see patients face to face for for periods of time. There've been windows when we can and windows when we weren't able to. Taking everything onto Zoom has been really interesting. We don't get the hands-on or the kind of face-to-face consultation, so there's something that is missed. You can't get to see someone's body language or the way they're protective over something when we're talking about a really emotive subject with them. We get to see most people from kind of the chest upwards, so we're missing out a lot of kind of body language and communication that we would normally see face to face. But for the pelvic pain clinic, that's gone really, really busy. I've now got 2-month waiting list. There were real issues with people getting to see their specialist or their clinicians, urologist, etc. So it's meant that there's been, and because we've been sitting down more so than we've ever been before, right?
Very
we're far
true.
more sedentary than we've ever been in our lives. Because our worlds have become smaller in many, many ways, for some people that's increased stress levels or reduced coping mechanisms. Some of the traditional things that I would maybe give a patient to do in terms of reintegration back into meaningful activities, like I can't say to someone, go and swim when we're in the middle of lockdown. That's just impossible. So having to be a little bit more creative, a little bit more adaptable. But yeah, for the last year, just over a year, 99% of my sessions have all been via Zoom or other platforms that are very similar to this as well. So,
But sorry, go on ahead, Karl.
I'm just glad I've been able to offer that kind of service and been able to keep people ticking along, because it's been, it's been a long, dark time, and I've still got patients around the world who are still in lockdown, still in a really, really difficult place. So thankfully, as you said, Gerard, summer's on the way here, looking a little bit brighter, and there are more opportunities for us to socialise and do things, see therapists, etc.
So although there are obvious drawbacks with doing the online appointments, do you also feel that, because people are at home and they haven't had to travel to see you and they're in their own space, that maybe they're more comfortable talking about those maybe more sensitive issues, whether it's the erectile symptoms, whether it's bowel, bladder, urinary, whether it's penile pain? Do you feel sometimes that people are maybe open up more?
It's a good question, and I was reflecting on this over the weekend. There's been, we had a conversation beforehand, even sometimes when you might have done a call with someone and they're sitting in their car taking the call.
Yeah.
Or they're kind of squirreled away in a little cupboard somewhere so that other people in the house aren't hearing them.
Yeah, and obviously
Generally
that's not
speaking,
ideal. The cupboard situation, the Harry Potter situation, not ideal.
No, exactly that. Generally speaking, because people are in their own environment, they're not having to travel, which can sometimes cause an increase in sensitivity or flare people up. Because generally they are much more at ease being in their own space, in their own domain, it means that conversations can probably progress a little bit quicker, a little bit deeper. But I've also found with this, like I've had even now, there are still a few people I'm seeing via Zoom consultations that are doing their sessions from their car. And it might be because they're living with their parents, for example. It might be that they're in a house share.
It seems to be a big thing in the Middle East.
Yep.
I'm not sure why.
No, and I think there's an element around masculinity, the change or the perception of masculinity, maybe their own self awareness of their own masculinity and what that's portrayed of in society. So yeah, it's a really, really interesting dynamic. It's probably brought up more opportunities, the COVID situation, for people being more open and being more free, but in other aspects, and maybe this is the younger chaps, mainly, kind of late teens, early 20s, if they are living in a family house or a shared house and they don't want anyone to know about it. In some instances, they're really, really closed up and they've been very, very aware of people outside or people in their building as well. So no, generally speaking, it's allowed people to be more it's allowed people more accessibility to treatments. But of course, there are the odd ones.
I think also possibly that because people aren't doing that kind of big commute and people are working from home, perhaps they've had maybe a bit more time to explore and maybe find some help. and also maybe prioritize their health.
Yeah, absolutely. Especially when there's been so little going on for, certainly over the winter, over the last, kind of 3 or 4 months before we came out of lockdown, there was nothing going on. There was no entertainment. You couldn't go outside because it was pretty cold here, or you'd have to be very creative about what you did outside. So yeah, I think that has been a case that people can maybe prioritize or better use their time for their recovery.
And say for the patients who will be listening to this, or those men who will be listening, or maybe their partners who will be listening, what are maybe 3 or 4 key things you feel is really important in male pelvic pain? I know you could talk about this for days, but 3 or 4 key things.
Yeah, it's a great question, and not an easy one to answer because it's whittled down to just a couple of points. But the first thing to note is that recovery is possible. It is possible to recover from pelvic pain. It's not an easy pathway. It's not something like clicking your fingers and all of a sudden it happens. It probably won't happen in a day or two. It's likely to be a process of unwinding or unlearning or relearning, changing old habits, protective behaviors, protective postures, learning to trust ourselves, our bodies once more, because often there is that, I don't trust my body, I don't fully understand what's going on again. But recovery is possible. There isn't a silver bullet. There's no golden fleece. It's going to take probably a couple of things working together with a good clinician that can help you to get out of there. If you try, so that's point one. If you try something that you've found, you've mentioned Reddit, Facebook, Twitter, other chat rooms, forums, etc., which are brilliant and definitely help people to find the right pathway, and it's a great support network as well. If you try something that someone else has found to be successful and it doesn't work for you, that doesn't mean you're a worse case than them. It doesn't mean there's no hope for you. Recovery is about individualized care, and what works for one person may not work for someone else for a variety of different reasons. And whether that's the driving mechanisms behind their pain, what's contributing to their pain experience, the onset of their pain, or the history, the duration of that pain experience, or even the way it influences them. So just because something doesn't work for someone else doesn't mean you're in a worse position from them. It doesn't mean you won't be able to recover. It's often about finding the right keys to unlock your particular case. I guess 2 other points that kind of contribute to this as well is flare-ups are going to happen. Like if there's one thing I'm going to guarantee, that they're going to happen. And it's tricky negotiating and navigating them by yourself. So having a good support network around you, working with a good clinician can be massively important. But often when we do have a flare-up, and I know this from personal experience and professional experience as well, our behavior changes. We do things differently, often because we don't want to for that flare-up to progress or for further damage to occur, but we tend to change our behaviors. We might do less of the things that we know are enjoyable and fun, often because we think, actually, I'm not sure it's a good idea if I do football, tennis, running, swimming, whatever it might be. We might search online a little bit more. We might start to go through the same articles or through the same forums or the chat groups or whatever else it may. Again, we may revisit those places of sources of information, and that can lead to further catastrophization and further worry and further concern. We may do more of things like stretching. We may be more fastidious over the diet or things that we tend to know that can help. So final point, and just to kind of summarize an awful lot of this and just to give some concise advice, would be do everything in moderation. Don't stop. Like when you're having a flare up, it's really, really easy just to go, fuck, I don't know what's happening. Sorry, excuse my French. I don't know what's going on. I don't like it.
We've got a swear word. We've got a swear. I don't think I can edit.
Cut it out. Cut it out.
Edit that out.
It's very, very easy to have that kind of overwhelming reaction. My advice to everyone is moderation is key. Like you can do pretty much and again, this is important to go through the clinician. You can do most things just in a much more moderated fashion. So I look at things like duration and intensity. And if you're dialing down duration and dialing down intensity, and this might be sex, it might be drinking alcohol, it might be coffee, it might be exercise, it might be anything. If they're dialed down and done in moderation, actually you'll find that there's far less up and downs. Things are a little bit more even keel and much, much easier to manage. So they would be my 4 take homes for patients.
Brilliant. And I think they're really, really, really valuable. And I think people will take a lot from those. Now, you've said that, you know, you're really busy online and you're getting patients from everywhere, really. I'm sure from lots of parts of the UK, from Europe, from all over the world. And I think we could both agree that we need kind of more people involved in pelvic health, and in particularly in male pelvic health and male pelvic pain. And both of us were very fortunate to spend time with Dr. Ruth Jones, and she had a big influence on both of us, it's safe to say that. And Ruth was brilliant at trying to get more people involved. She was brilliant at trying to get more therapists, whether it's physiotherapists, sports therapists, more therapists involved. And I think we need more people. So kind of from your experience, Karl, you know, how can we maybe say 1 or 2 things? How can we get more people involved? Because we need more people.
Yeah, it's a really good question. I suppose, you know, finding someone's interest in this particular field, my interest came from a personal experience. Everyone's interest as to why they go into a particular line of therapy is going to be, you know, probably personalized for individual reasons. We need more therapists, so there's opportunity for work out there. You know, there are patients out there that need the care, they need the support and the guidance in recovery. So there is opportunities for work out there at the moment. That realizing that you can make a difference in someone's life, in their recovery, and have a positive hand in that is a good thing. There are more and more resources available at the moment, and you know, one thing that COVID has thrown up for us is that so many things have gone online as well.
Very
I'm
true.
sure even for Gerard Green seminars and things like that, there's much more accessibility for people, UK, Europe, globally, that they can log on and do these events much more readily available instead of having to travel to go and do them. You know, Ruth's course was down in
London.
Yeah, usually to London. That's right. Yeah, you know, Ruth's course was down in Southampton, but even that can be a bit of a barrier to getting to see someone. You know, London's very central, but it's not very central if you're living up in Newcastle or Scotland, or you know.
For those of us outside London, i.e. in Birmingham, we always think it is so expensive to go to London for a weekend.
Yeah, absolutely. Yeah, no, totally. And I'm with you there. And I don't live in London, you know, I live just outside, but my commute's a little bit easier than yours. Whereas now we've just gone and everything is much more accessible and online. So find a good course, you know, look at your Gerard Green webinars and seminars, look at Physio Online and the work that Evie and Bill Taylor are doing at the moment. Look at Pelvic Pain Matters. There's more and more opportunities for people now to be involved with online training, and it's a great introduction. Of course, we want the hands-on stuff. We want that to return because there's, you know, far more clinical applications, hands-on applications when we can see people face-to-face and train people face-to-face. But in the meantime, get online, start doing some of those online courses. It's a great step in that direction.
So you do a lot, Karl. You know, you do a lot with patients. You do a lot with the Pelvic Pain Matters. You've got 2 young children. So what do you do to relax? Because this is demanding work. This is demanding work.
Yeah, sorry, mate. I've just got someone outside knocking on my door for a delivery.
You know them?
I don't.
You don't need the police or anything, do we?
No, that's right. No. Sorry, ask me the question again, Gerard, the final bit.
So you do a lot, you know, you see lots of patients, you've got the Pelvic Pain Matters, you do lots of other stuff, I'm sure. But, you know, pelvic pain is a demanding area to work in. It's a demanding area to work in. So what do you do to switch off and relax?
Yeah, thank you. I thought that's what you said. So I'm fit, I'm active. I try and remain fit and active. So for me, and lockdown definitely was a bit of a struggle with that. So now it's open again. I'll go and play tennis. I can run even during lockdown. I meditate every single day. I've got a strong meditation practice. It's something I've done for 20 years. And for me, so yoga or home exercises, like I said, things have really changed in the last year. I'm doing so many more classes and exercise things at home now. It might be from kickboxing to Vipassana meditation or slow flow yoga, hatha yoga. There's lots and lots of things now that are much more available at home. So whereas beforehand I'd have gone and played football or gone to the gym or gone and swam, there's now much more accessibility at home for myself. So yeah, swimming, tennis, yoga, running.
Yeah, no, it all sounds it sounds very rounded, which is good. And who inspires you?
Oh, who inspires me? You know, my patients inspire me. Every single time I see a new patient or we come across a new challenge in someone's recovery, then there's an opportunity for me to learn. And there's an opportunity for me to say, I don't know everything. I can't claim to know everything. There's an opportunity for me to go away and study, do some more research, come back, work with that patient, sit down, work on their goals and their aims and their objectives. But yeah, definitely the biggest influence over my practice and the way I run my clinic is the patients, because they teach us stuff all the time. There's opportunities for us to learn all the time.
Definitely. And it sounds like, you know, I think all of the work we've done in the last 12 months has changed dramatically. And, you know, you've kind of articulated that very well, and that you've moved to a really strong online kind of clinic format. And you're obviously developing or continue to develop the Pelvic Pain Matters project. So what's next, Karl? What's next? Apart from showing me how to set up that green screen with some.
Done. Well, that's the first thing we'll do. What's next? Getting back into clinic and seeing patients face to face. That's trickling through now. There's more opportunities. I was working up in Islington, North London. I stopped that. That was a 2-hour commute each way. So for me, getting back and seeing patients face to face. I'd like to take on someone else in my clinic. You know, so you mentioned that there's opportunity. So I'd love someone else to work with me in the clinic so I can see more patients, and to continue to develop recovery programs, recovery strategies, different opportunities for patients. I do everything one-to-one at the moment, but there are opportunities for workshops for patients where we do like a group mentoring session. So instead of just seeing one person, that we might be taking together 4 or 6 people in a series of recovery workshops to help people get through that, to make it more accessible to people, because it's not always accessible, whether the location or the fee. So if we can make it maybe online, some of it online, some of it face to face, but reduce the fee so as more people can get on to the same recovery opportunities as other people can. That's what the future is looking like for me at the moment.
And then I've kind of got 2 things to ask, and I don't want to forget either of them. One is, and that kind of group situation is really interesting, because a lot of patients say, and I'm sure they say it to you, is, you know, have you seen anyone else with these symptoms? So it might be someone with penile pain, or it might be someone with rectal pain, or it might be someone with urinary. They'll go, have you seen anyone else? Or then they'll go, you know, are there other people like this? And I think what I say to them is, you know what, if you hurt your knee, you'd be chatting to your knee with the people you work with on the building site, or you'd be chatting to people about your ankle or your hip in the solicitor's office. But probably unlikely that you're going to be discussing your penile pain or your ejaculatory pain, you know, at the water cooler or on a Zoom meeting. So I think that group situation is inspired.
And most of thank you, Gerard. Most of the key issues with pelvic pain is it is so personal. It's such a hidden illness. As you said, someone at the post office could turn around to you and say, "So how are you doing today?" "Oh, shoulder's a little bit sore." You couldn't show them your trouser department and say, "Look, there's something going on down here. Any suggestions? Any creams? Any ointments? Anything I can do?" So it is much more isolatory, and patients often feel like they're the only people in the world that are going through their symptoms. So if we can bring them collectively together in like phenotypes or common locations or sensations or symptoms or the knock-on effect, then actually they can provide their own support network anyway amongst themselves, but we're working towards common goals.
And I think also, Karl, the point you made is that, I think it was your first or second point, that if you try something that's worked for someone else, say something online, and it doesn't work for you, that's okay. Because I think that because there isn't a huge amount of information research out there, I think a lot of men feel that all pelvic pain is the same. Whereas we know it's not the same. People present with kind of almost different types or subcategories. So I think that's a really important point to make. Then the other thing is, so Karl, how do people find you? How do they find you online, or say at some point when things change, how do they find you physically to see you face to face?
Yeah, so I'm based in Epsom in Surrey at the moment. We do have a clinic at the back of the house here, so I'm seeing patients, dribbling through, probably not the right word to use, dripping through face to face now again, which is good. Otherwise, online it's the pelvicpainclinic.co.uk, and it's pelvicpainmatters.com for the webinars and for the online resources.
Brilliant, Karl. Listen, a really big thank you for one, agreeing to meet up and chat. We could do this for hours, but I'm mindful people have to listen to us, and I think sometimes if people look at an interview, they see it's 30 minutes, think that's doable. Whereas if it's 2.5 hours to think, these not sure about this. So I really appreciate that, Karl, and it's been I've really found it inspiring, and I've learned a lot from speaking to you. And do you want to say anything before we go, before I turn the recording?
Yeah, just to say thank you for this opportunity. We are a community. We should work together for the benefit of the patients, and it's important that we do work towards that common goal and to give people more hope in recovery. And again, I'll say it was one of my first key points. Recovery is perfectly possible. It's not going to happen overnight. It's going to be a bit of a journey, but best to do it with someone experienced and someone clinician knows what they're going through as well.
Brilliant. Karl, many thanks, and enjoy the rest of your day. I believe the small people are on their way back to swimming, and hopefully a nice parcel has been delivered. So thank you once more. I really appreciate it.
You're most welcome. Thank you very much.